We're talking with Dr. Lynn Butterly, the director of colorectal cancer screening at Dartmouth-Hitchcock, about when to start colorectal cancer screening and how often one should have a screening. If I'm in an average risk group for getting colorectal cancer, what are the recommendations for when I should begin screening, the age I should begin screening, and then how often should I get colorectal cancer screening?
So if you're at average risk, which means that you are age 50 and you do not have a personal history or a family history of colorectal cancer or polyps, it's just that you've turned 50 and you know it's time to begin screening. As we said, you have options available and you're going to talk to your provider about what test is best for you. If you have a colonoscopy and if we find nothing, so let's say you have a colonoscopy, no polyps are found, you did a good job with your prep and we could see your whole colon well, then the recommendation would be for you to come back in 10 years. So average risk people who have a complete, well-prepped colonoscopy and no polyps are on the 10-year plan. People who are at average risk who have hyperplastic polyp, especially the small ones, are also on the 10-year plan because those polyps do not confer an increased risk of developing colorectal cancer. People who are at average risk who are then found to have a polyp, if it is the type that could potentially become cancer, then depending on the size, the number, the specific type of polyp, they would be, in general, on a 3 to 5 year plan.
Are the recommendations the same for women and men?
So there have been studies published that suggest that women may have a higher percentage of polyps on the right side of the colon. What I mean by that is the colon, if you look at a person facing you, goes up your right side, across, and down the left side, and then out through the rectum. And it doesn't really follow that pattern in most people, but that's the general outline. So when you first do a colonoscopy or a sigmoidoscopy, you enter through the rectum, the first part of the colon you're looking at is the left side. So when we do a sigmoidoscopy, we are looking at the left side of the colon. If women were more likely to have polyps on the right side of the colon, then that would suggest that women should be screened with a colonoscopy rather than with a sigmoidoscopy, in other words, the average risk group of women. That has not caused, there's not enough evidence as yet to cause a change in the guidelines, but it is something to consider and talk to your provider about. Another example would be that it is thought that colorectal cancer may develop at an earlier age in African Americans. So African Americans may want to start screening at age 45 instead of age 50, even though they are at average risk. That is another recommendation for which there is some evidence and are among the things that we are trying to study in order to determine what is the optimal way to do colorectal cancer screening. So that's another reason why it is very helpful to talk to your provider. Polyps are more common in men, but there is an approximately equal distribution of colorectal cancer. So when men come in and say, well, it's a woman's disease, I probably don't need to do this, and women come in and say it's a man's disease, I don't need to do this, I'm afraid we can't buy either of those rationales. Colorectal cancer screening is really for everyone, and when you should start and how often you should do it and which test you should have are individual decisions that you and your provider can make based on your individual situation.
And so just to recap, every 10 years, starting at age 50, if you're an average risk, and we also identified there's an increased risk group and that they would do that perhaps at an earlier age and more often, and then there's a high risk group which would sort of have their own special plan depending on...
Right, much earlier. The 10 years, though, in the average risk group is only if you have no polyps, no adenomatous polyps are found on your test, and we saw your whole colon and we could see it well. Then you can be on the 10-year plan.
Understood. And so that's another reason why it's important to do your preparation for your colonoscopy well.
Absolutely. That, those few hours of grumbling and mumbling and not liking it very much make a huge difference. And the other thing that can happen is if you decide not to do the prep adequately and you come in and the endoscopist really can't see well, even if they can complete the test, you're likely to be looking at an earlier follow-up, because we want to be sure we haven't overlooked any small lesions that might have a chance to turn into cancer before your next test. So the better we can see, the better for the patient, and the longer we can let the follow-up period be.
So you've been doing this for a long time. I assume you've heard a lot of excuses about why people don't want to do colorectal cancer screening. What are some of the more common excuses that you hear?
Well, as we said, there's a whole variety of reasons that people can be very creative, and they can come up with all kinds of reasons. But the common ones would be, I can't possibly do the prep. I can't possibly drink that much liquid. Usually, if you follow the tips and the tricks, it helps a lot. Millions of people are able to do this every year. And I think just really trying to give it a try and remembering that what we're trying to do here, we're trying to prevent you from getting colorectal cancer. So it may not be a lot of fun, but there are many worse things to be doing. And if you go at it with that attitude, that often helps. Other things would be needing transportation, living at a distance from the endoscopy center. Fear is a big one. People are sometimes... They realize having a colonoscopy isn't going to put a cancer in your colon, but they are afraid that if they have the test, somehow something bad will be found and something bad will happen. And so it's often encouraging to people to realize that if they come at an appropriate age for screening, they're very, very unlikely to have anything bad. They may well have a polyp that we can remove, but that will decrease their chances of having cancer later in life. And then, of course, there are issues of insurance, financial issues. There are many issues that are very difficult, and they are significant barriers to having colorectal cancer screening. And that's one of the reasons that we're very happy that we were able to work together with the New Hampshire Department of Health to obtain a CDC grant, which allows us to provide approximately 375 free colonoscopies a year to low-income, uninsured New Hampshire residents between the ages of 50 and 64, because they need to be uninsured, and at 65, Medicare kicks in. But to uninsured, low-income New Hampshire residents between the ages of 50 and 64 every year. We encourage people to take advantage of that if low income and lack of insurance is a barrier. You can talk to your provider about that, or you can contact the Colorectal Cancer Screening Program at 653-3702 to determine whether or not you're eligible. And we are hoping in that way to be able to ease that one barrier anyway of having low income or uninsurance, so that everyone will have the opportunity for the preventive benefits of colorectal cancer screening.
And so that program is for New Hampshire residents only?
Yes, it's a New Hampshire program in conjunction with the Department of Health.
In our last podcast series, we talked about immunizations and about what life was like before we had common immunizations for things like polio, for instance, smallpox. How long has colorectal cancer screening been available to people?
And colorectal cancer screening has been around a very long time, over 50 years and longer. But over the years, the evidence behind how well it works has become stronger and stronger. And in 2001, in July of 2001, Medicare began covering colonoscopy for the purpose of screening. So before that time, there was more emphasis on sigmoidoscopy and on fecal occult blood testing. And at that point, we underwent a relatively major shift in the direction of colonoscopy. But the point is to have screening and to talk to your provider about which test is right for you. It is covered. It is a covered benefit in most cases. Again, your provider may be able to help you with that. And something very important to do in terms of protecting your health. But it's been around a long time. And I know people say, well, if colonoscopy's been around all this time, why can't you people do a different prep? We've tried. It's not for lack of trying. And one day we will get there. But the prep is manageable if you follow the little tips and tricks. And having screening in general is a very important thing to do.
Do you ever think about the number of lives that have been saved through colorectal cancer screening, or the impact that having this program covered, having colorectal cancer screening covered as part of most insurance plans, how many fewer people there are who went through an awful type of cancer?
Absolutely. And it is, I think, one of the things that drives many people who are in the business of delivering and promoting and improving colorectal cancer screening. Those are the things that drive them, because we know that we have the ability to prevent cancer for many people, colon cancer, for many of the people who might have otherwise had it. So being able to do that is something very valuable that you can share with the community around you, and is very much a driving force in the people who do this kind of work. Likewise, I should say that one of the things that has struck all of us, in particular about the colorectal cancer screening program, the part of it being free colonoscopies for low-income uninsured people, is that that is just the most wonderful, grateful group of patients you will find. People clearly have had their consciousness elevated about the need for screening. When we first started, I thought most people would say, oh, who wants to do that? But that's definitely not the case. I think the vast majority of people really understand the value of screening and want to participate, and are just wonderful about being presented with an opportunity to make it a little bit easier for them. And so it becomes an extremely fulfilling type of work for all of us to do. And I think of real benefit, hopefully, to our community.
Final question, unless we have some more. If someone wants to set up an appointment for a colonoscopy, what should they do? Is the first step to call their doctor?
Yeah, they should call their primary care provider if they have one. If they don't have one, then finding out what healthcare facilities are near you that would be appropriate, whether it's a community health center or a hospital or an outpatient clinic, and starting there, because there are obviously other things we'd like to do. We want to make sure your blood pressure is in good control and that your general health is where it should be, that you're on medications that you need. But as part of that, as part of your general wellness, colorectal cancer screening plays a part in all of that, and is something you would definitely want to talk to your provider about. Now, having gotten a general idea about what screening is about, what tests there might be, who should have which test at which time, it allows people to have an informed conversation with their provider so that they can feel good about the type of screening that is chosen for them. It's often said that the best screening test is the one that gets done, even though we do have guidelines that allow us to know which test is best for you. And so in conjunction with that, I would say that it is the best form of screening is doing it. Going to your provider, talking about the tests, and ensuring that you do take advantage of this service that will have potential to actually prevent you from having colorectal cancer, and is definitely something valuable to do for yourself.
This Healthy Highlight is brought to you by Dartmouth-Hitchcock and Ledyard National Bank, working together with our community partners to improve your well-being.